Okay, to anybody in the back, if I start doing this and you can't hear me, let me know. And to the presentation, go back. There's parts that purposely go black because it's waiting for the next part, so. You want me to? Well, here, I'll do it. Okay, I'll do it. Hello, hello, hello. Better? Perfect. I got my hands to read my papers. Okay, my name is Jeff Whitebread. When Dr. Kaufman asked if I could give a presentation here at the Chicago Melanoma Symposium, I told him I'd be happy to, but what do I talk about? He said, just tell your story. Easy as toast. My melanoma story starts in September of 2006, but I didn't know it at the time. My oldest and most energetic, Mia, had just turned 4 months old. She kept us quite busy and with crying, waking up in the middle of the night, and entertaining us to no end. But I did find time to notice a mole near my right temple, which kind of just popped up. At first, my wife and I thought it was nothing, then maybe a sore, and then after about a month or so of it looking weird, dark, and misshapen, we thought it was a good time to visit a doctor. After looking at it, my primary care physician at the time said it looked a bit angry, and the thought was to cut it out, send it to a lab, and go from there. The doctor did just that, and after hearing it was benign, my wife and I were relieved. I was 26 at the time, fairly healthy, and although my father and grandfather have had basal and squamish freckles removed, we weren't too concerned as I wasn't nearly as freckly, and again, fairly young and healthy. Time went on. My sweet and smart son Casey was born a year later, and my wife and I were quite busy with 2 under 2. We both watched as they grew bigger and bigger, and our condo grew smaller and smaller. We moved out to the burbs right before the housing market crashed. Kids were healthy, my wife was healthy, I was healthy. We were lucky, and life was normal. My story, however, takes a turn late in October of last year, when I noticed a bump under my right earlobe. It was about the size of a mosquito bite, but it didn't itch, so I thought it might have been a spider bite. It didn't go away after about a week or so, so I visited with my employee nurse at work. She didn't know what it was, but the thought was to get it checked out from your primary care physician if it didn't go away. Well, it didn't go away. After about 3 weeks, I visited with my primary care physician in early December last year. Took a look, thought it might be a swollen lymph node, gave me some antibiotics to knock it down, and said if it didn't go away, go visit a specialist at your work. I work for Rush. Well, it didn't go away. I made an appointment to meet with an ENT early January of this year. The ENT took a look, thought it was a benign cyst on my salivary gland right here, decided to do a fine needle biopsy, and we'd know what we were dealing with in about a week. A week came and went, and in sitting with my ENT, he informed me it was a rare salivary gland cancer, but wouldn't know for sure until they got more tissue samples. The next step was to remove the salivary gland. The next 2 weeks while waiting for surgery, I learned all about salivary gland cancers. I found a salivary gland cancer forum and spent countless hours on the internet doing research. I also researched the surgery to perform and found a possible risk was facial paralysis of the surgery side. I discovered that if the scar down the front of the ear and kind of curves like a little S gets extended into the neck, then the cancer had spread to the lymph nodes as the surgeon had to remove them there. 2 agonizing weeks went by, and by this time I was fairly comfortable with my disease. The surgery date was upon me, and I was actually more nervous about the anesthesia than the surgery. When I came to, and with my immediate family at my bedside, I asked, did he cut into my neck? He had. Although he went in my neck, he felt he only had to remove a portion of my salivary gland. We asked if he got all of it, and he thought he did. We were happy. A week A week later, we were in to get the results, and I spent time relaxing and taking pain meds. Or was it taking pain meds and relaxing? We went back a week later, and pathology wasn't ready yet. Went back a couple days later, and my wife and I were informed the pathologists were stumped. Apparently, I'd already beaten salivary gland cancer, but had just been diagnosed with melanoma. We brought up the mole removed 4 years ago, and they asked if they could get a sample. Made the phone calls right then and there, and there was more waiting to see what they would find. My next steps were to meet with the melanoma oncologist for a rundown. While waiting for my appointment, and although I was told to stay away, I was on the internet as well as everyone in my family who isn't a doctor. My mom found the MRF, and we were quickly on the patient forum to see what the heck was going on. She posted to the site, Jeff's mom, and the responses were quite informative. We liked the information we saw, but were disheartened by others. Regardless, it became a nightly routine for me to visit the patient forum just to know that there's other folks out there and to read what I may or may not experience. Now this is where my story hits the fan. Before meeting it with my oncologist, the lab work from the original mole came back with new results. If you couldn't guess it, they missed it. It was melanoma back then, with positive margins, and supposedly already stage 2. We were a little distraught from the misdiagnosis. What could it have been had this been caught? As hard as it was, we couldn't dwell much on that and had to look forward. When I finally met with my oncologist, and after a PET scan, I was informed I had stage 3B melanoma, more than 1 but less than 4 lymph nodes involved. My next treatment options were a MAGE-3 clinical trial, which I later found out I wasn't available for, 1 month high dose with 11-month low dose interferon, or wait and see. I wanted to do something, but had some time to figure out what as I was recovering from my surgery. And having melanoma for 4+ years, relatively untreated, and only having it in the lymph nodes, it was probably the best news we could have heard regarding the situation. Doing my diligence with second opinions and treatment options, I visited with other specialists. I made phone calls to Florida, Maryland, Colorado. I visited with another local melanoma specialist, and my treatment options were the same. When I was told I had a rare salivary gland cancer, we made appointments up at the Mayo Clinic in Minnesota. Although my diagnosis changed, we kept the appointments and headed up there. After meeting with a few folks, Mayo came back with a different plan. Said they want to treat me like they would have 4 years ago, knowing the mole was the original, except with more lymph nodes involved. Said the surgery I just underwent was with the assumption of salivary gland and not melanoma. It made sense, but what this made for me was another parodectomy with full gland removal and more lymph nodes removed. Melanoma could still be lingering, so let's get it out. My wife and I agreed, and 5 days later I was getting the same procedure I was a month ago. With the surgeries being so close, risk for facial paralysis was much higher, and although a bit nerve-wracking, I thought if it meant more time with my family, I didn't care if I looked like Darth Vader. That's me doing 2. The second surgery went well. I had some lip and eyebrow paralysis, but more importantly, every tissue sample and lymph node removed came back negative for melanoma. They did detect it in more lymph nodes from the original surgery for a total of 7, and my staging changed from 3B to 3C, which meant my chance of recurrence went from 50% to 75%. They had a treatment plan of offering leukocyte after radiation. Now it was up to me to figure out what to do. The hardest part of my story so far was deciding on a treatment. I wanted to do something, but my only options if I were to stay in Illinois were leukocyte and/or interferon with radiation. Each oncologist had a reason for their decision, and it was really up to me. I'm quite indecisive to begin with, and something so important like this took a lot out of me. After consoling with loved ones, I decided I'd get radiation first, then interferon, then leukocyte. I went to a local specialist with my plan in hand, and wouldn't you know, I changed my mind. Literally the last second, my wife and I decided to do the high dose of interferon first, then radiation, then low dose interferon, then leukeine. Although I wanted to zap anything still in my neck, the thought was to attack anything that might have already spread. I was in the infusion room later that morning. I did the high dose month of interferon, and for some reason, it didn't like me. Each week was kind of the same. Monday was a high fever, Tuesday was worse, Wednesday tapered off to Friday, and then repeat. My dosage was dropped twice within the 20 days, my white count dipped, and I became neutropenic. But I did meet some really nice infusion nurses, and I became quite familiar with my bed. Oh, geez, sorry about that. All joking aside, the best thing during my treatment was the birth of my daughter, Lila. My wife and I lucked out, as with everything that was going on with me, Lila was as healthy as can be and is still to this day the easiest of our 3 babies to take care of. Maybe she knew what we were going through. This is what. All right, click it for me. Okay, and yes, this also means that when I found out I had melanoma, the realization of the misdiagnosis, the 2 surgery recoveries, and the first 2 weeks of high-dose interferon, my amazing and beautiful, or is it beautiful and amazing wife, Melissa, was traveling with me, helping me recover, and navigating through these difficult decisions, all while being no less than 5 months pregnant. 2 weeks after my last infusion, radiation was next. This I could handle much better. I had 5 zaps totaling 30 grays to my temple down to my clavicle. I lost taste for a while there, which was interesting. It was hard to swallow for about a week. Lost a couple pounds and some arm movement, but that was it. Most came back. The only permanent changes I know of are the loss of some salivary function, which, drinking all this water, and possibly this bald spot near my ear, which is a bummer because that was my favorite place to grow hair. With radiation over, it was time to do the low dose of interferon again. And after about a week or 2, it just wasn't working. My body reacted just as strongly, and I was deemed pretty much useless again. After seeing my blood levels take a hit and personally wanting to give my poor wife some parental support, my oncologist and I said it would be best to let my body get back to full health. Was this the right decision? I'm not sure we'll ever know, but it seemed right at the time. I brought up doing leukeine, and my specialist felt the juice wasn't worth the squeeze. The goal would be to get tightly monitored with scans every 3 months for 2 years, and if clear, every 6 months for 5 years, for the next 3. I had a 3-month scan in May, a 6-month scan in August, and a scan just this past Wednesday. And I'm fortunate to tell you I'm 8 months NED. So this is where my melanoma story is, standing in front of you at the first annual Chicago Melanoma Symposium, shamelessly showing off my family whenever I get the chance. Medically, I'm just playing the waiting game. My wife and I get pretty nervous when the scans are due. I'm sure my whole family does. And with the past 3 being clear, we love celebrating the good news. Most days, I believe I've already beat it and can't possibly think it's coming back. But others, I wonder if I'll be able to see my oldest off to college, my middle graduate, or my youngest get married. If I don't, maybe I was never supposed to. But what I do get to see and share with them, I'm holding dear to my heart more than ever before. So in closing, I want to thank the doctors out here for doing what you do. Just in my time with the disease, Yervoy, as well as that one I can't say, has been approved by the FDA, and I'm seeing and hearing positive news regarding the future of treatments. Throughout your hard work, people like me are getting to share more days with loved ones, and that can never be repaid. And to all the other folks out there with your own melanoma stories, just like a good book or movie, here's to hoping the end is the best part. Yeah.